My name is Elena Kidd, and I am a program director in the Office of Public Health Practice at the School of Public Health. We are very excited to welcome you to today's webinar, Who is Caring for the Public Health Workforce? Today's webinar is made possible by the Office of Public Health Practice and the Public Health Student Association. Each sponsor is offering virtual events throughout the semester, so please check out their websites and social media for updates. So it's now my pleasure to introduce our amazing speaker for today, Dr. Kaye Bender. Dr. Bender is the owner of Kaye Bender Consulting, LLC, where she works as an independent public health, organizational, and education consultant and strategist. She also serves as the executive director of the Mississippi Public Health Association. She is a part-time professor at the University of Mississippi School of Nursing and the School of Health-Related Professions. Dr. Bender served as the president and CEO of the Public Health Accreditation Board, FAB, in Alexandria, Virginia from 2009 to 2019. She was the dean of the University of Mississippi Medical Center School of Nursing prior to FAB. She worked in local public health for several years in Mississippi and was the deputy state health officer for the Mississippi Department of Health for 12 years. She serves as the president of the American Public Health Association since October 2021. She's also a fellow in the American Academy of Nursing, a board member of the National Board of Public Health Examiners, the Public Health Foundation, and the Mississippi Public Health Institute. She has numerous publications and presentations related to governmental public health infrastructure improvement. Dr. Bender holds a BS in nursing from the University of Mississippi Medical Center, an MSN from the University of Southern Mississippi, and a PhD from the University of Mississippi Medical Center. So thank you so much, Dr. Bender, for being here today and taking the time out of your schedule to talk with us at UAB.
We're going to talk today about who's caring for you. Whether you're a student and you're about to be a member of the public health workforce, or maybe you are a member of the public health workforce and a student, and certainly the faculty and staff who support you. But I hope it won't be a Debbie Downer kind of presentation because we are going to talk about both the realities and some really cool things, at least I think cool things that are happening with the workforce. So let me see. So first, I want to bring you greetings from the APHA, American Public Health Association Board of Directors. We just had our first meeting of the year in January, virtually, you can see here. You may recognize some of these people that you know. But we talk all the time just about how much we appreciate our schools and programs in public health and the students who are going there. We also talk a lot about why collective voices matter in public health. And it matters because, as we'll talk about today, both the workforce and public health have undergone some tremendous pressures, as you well know, including you trying to learn or teach or support those who do both during the pandemic. But our collective voices do matter, and we need to be speaking about our public health workforce and the needs. Dr. Alan Hinman, who's past chair of the APHA Board of Directors and past speaker of the Governing Council, talks about the APHA family and the members, the 25,000 members, as being like a family and being much like other families in that we have successes and failures and celebrations and fights. I don't know about fights, but disagreements and reconciliation. But yet we're kept together by a bond that is certainly not of blood, but of commitment to improving the health of the people and the families and communities, not only in our communities that we serve, but around the world. And I want to take this opportunity just to give a shout out to some members of the UAB family that I'm just have been pleased to know for a long time, some of them. Others that I've just gotten to meet, and I'm sure I'll miss somebody, but I just want you to know, as a fellow Southerner, the status and the reputation and the credibility that the UAB School of Public Health has is tremendous. And I know the students know that, or you wouldn't have applied and wanted to be admitted there. And I hope you as faculty and staff know that as well. You have an amazing leader in Dr. Paul Campbell Irwin. I've known Dr. Irwin for quite a period of time, and it's been such a pleasure to work with him. I've seen him work both when he needs to be formal, as he does when he wears his dean hat, and also when he's really being a compassionate, caring public health person, giving care and working with communities both in the U.S. And internationally. So you have an amazing leader there who I respect and admire tremendously. It's also been fun for me being back in Mississippi, right next door to you. That's my home state, and working with the Mississippi Public Health Association last semester to work with Lisa McCormick. Lisa's also awesome. And last semester we were pleased to have 3 students intern with us or do their practicums with us: Courtney Marlowe, Kyla Lewis, and Marla Kelly. And then we have 2 this semester, Jennifer Kiefer and Rose Michael. And we are just enjoying that relationship with UAB. And I hope we continue that, and I hope the students are getting what they need from us, because we certainly consider them part of our family. So this webinar, as I said, is about you. We want to talk about who the public health workforce is, talk about the public health as a profession. And there'll be a point there where I would love for you to begin to think about putting in the Q&A or chat box why you were interested in public health as a profession. And we'll stop and talk about that at some point. And then I want to talk about some relatively new national initiatives that are aimed at strengthening the workforce, and then if we have time, dive a little deeper into APHA specific strategies. So please make this interactive, and all through the presentation, put your comments, your thoughts, and we'll pause and look at those as we go through. So through the years and the time that people like Dr. Irwin and I've been in public health, we've had this interesting, not exactly a debate, but discussions about who is the public health workforce. And many members of the public, as you know, tend to think about the public health workforce as those who work in governmental public health. And that is true, that is part of it. But for me, it's people who carry out any one or more of the 10 essential public health services. Whether you work for government, whether you're faculty, you're a researcher, you work in policy, you work in a nonprofit, it really does take all of us to be about the business of protecting and promoting the health of the public. And then those who carry out the foundational capabilities, and I'll talk about this a little bit more later, has been more and more an emerging theme about what it is we expect the governmental sector of public health to do. Another issue that we very often have spirited discussions about is just how many of us are there. So when we talk about the workforce, It's difficult to count. In 2000, so 22 years ago now, almost, Dr. Chris Gebbe and her colleagues attempted one of the first sort of detailed enumeration studies to just answer that question. And it became evident at just how complex it is to count the public health workforce. And in government, it's because of the various ways that merit systems and personnel systems classify governmental public health workers. But for those who don't work in government, their titles are all over the place. So one of the things that this study pointed out is it really is a daunting task to try to think about how many of us there are. And I suspect that we will find with more current enumeration studies that will become even more obvious after COVID, because we know that we've had all kinds of people working in public health to help with contact tracing, vaccine distribution, education, and epidemiology research, those kinds of things related to COVID. In 2012, the University of Kentucky and the University of Michigan, both of whom had Centers of Excellence in Public Health Workforce, partnered with a CDC-funded study to try to enumerate the public health workforce. And actually, their follow-up study focused more on the types of methodologies and the many ways that one might go about looking at the public health workforce and actually be able to come up with a net count. And then in 2014, Beck Bolton and Coronata actually took some of those methodologies, and 2014 has been a long time ago, but they said at that time that there were about 300,000 public health workers who work for the government. 50, 30, and 20% who provide services in local, state, and federal, respectively. And then of those, about 19 or 20% were administrative or clerical, and then which represented, of course, the largest percentage, followed by public health nurses at 16%, environmental public health workers, public health managers, and laboratory workers. And I suspect that if the study were repeated now, we would see similarities, but also some pretty significant shifts. You may be aware that one of the latest attempts to answer the question about how many public health workers are needed was actually funded by the de Beaumont Foundation through the Public Health National Center for Innovation. And this study is called Staffing Up, really does speak to consistent decreases in the number of governmental public health workers, as you can see here from 2008 to the onset of the pandemic in 2019. And based on looking at all of the enumeration projects, this new analysis showed that we need about 80,000 more full-time equivalent positions in governmental public health, state and local, it did not speak to federal, in order to just provide basic services. And this particular project defined basic services using the foundational capabilities that I mentioned earlier. But if you look at that, that's an 80% increase just to provide minimal services. So it looks like a really dire picture, but when you hear governmental public health, being criticized for the way it handled or didn't handle COVID. We see that, the public health workers' presence or absence really do make a difference. And I'll speak a little bit later about the increased use of intermediaries for the public health departments to be able to have surge capacity for their workforce. Of course, you all know that we're still dealing, now going into the third year with the pandemic, and particularly the Omicron variant. We're still dealing with people who still think it's a hoax, that it's a fake crisis. And we see that quite a bit here in the South where we're located, but also really around the country. And we're still dealing with a lot of misinformation. I think there's no doubt for those of you who are students, and particularly younger students, you've grown up in a world where it's pretty easy to go online and do your lit reviews and look for the kinds of information you need to be able to write your papers and do your projects for your course requirements. It's another thing when the public does that and really lacks the skills to be able to adequately discern what is good science versus what is junk. And I think we've seen that manifested with COVID in a way that we had not seen it before. And then, of course, you may have seen this chart. I know that a lot of communications courses faculty are using this chart. This is research that was done by Ad Fontes Media, looking at media bias and just how much as we use media, as we read social media, and as we look at the various media outlets, who's seen as the ones that are the most reliable, the most trusted because of their objectivity. I do kind of get a chuckle a little bit out of this particular study because if you look right here in the very center, for those of us who are in the South and worry about hurricanes and tornadoes, I think we can feel good that the Weather Channel is seen as one of the more objective, less biased sources of information in the media. We also know, this is one study, there have been several, that our public health workers, along with our healthcare workers, counterparts, have experienced an increase in mental health issues with the pandemic. And the longer the pandemic goes along, the more of this we are seeing among public health workers. And it's all the way from depression to out anger with the public about not taking more responsibility for vaccines and for masking and those kinds of things. And it's really become quite an issue among public health workers. And then there's this whole phenomenon of Zoom fatigue. And it could be go-to-meeting fatigue, it could be Canvas fatigue, whatever. But just this fatigue with constantly, consistently sitting at the computer for those of us who are in the workforce with one meeting right after the other, which we had before COVID, but with the good parts about being able to have our convenings now virtually, we seem to have gone overboard with one right after the other. And I would imagine that some of you in class both appreciate modern aspects of online learning, but also have just some time when you need to get away from the screen, get out and attend to your own wellness. So the reason that I have remained consistently interested in the workforce, not only because those have been my colleagues for my entire career, but I am convinced that our public health services that are delivered either by the governmental side or by the nonprofit side or in schools and programs in public health are only as good or as solid or as confident as our workforce that delivers them. So I'm going to read through this slide, and then I'd love to see some items in the chat about how you're reacting to being either a current or a future member of the public health workforce in terms of just the whole COVID experience and the mental health aspect, and how you've kind of felt as a public health student, probably adjusting to in-person classes, sometimes online classes, sometimes, and then dealing with your family. Just share, and you can do it anonymously if you like. There are some positive things that I think will come from the COVID experience. We're already seeing attention to additional public health infrastructure funding. And that's both a blessing and a curse. The blessing is those of us who work in public health, no matter what our roles, have the opportunity to see increases in funding that could strengthen our public health infrastructure over time. The curse a little bit about that is we very often see public health departments, nonprofits, and schools of public health have to spend the money in such a short period of time that it really often gets in the way of being able to do really good strategic planning for long-term infrastructure impact. We are seeing additional discussion and attention to the public health workforce, so I'll speak about that in a little more detail shortly. But I think for those of you who are entering the workforce, you can take heart that there are some really cool things going on at the national and federal levels that hopefully will impact down to states and locals, both private and public. One of the things that I'm intrigued by is COVID pushed us to use telehealth a little more, especially in our rural areas, a little more than we had probably would have diffused that innovation. And I think that's really a good thing. And I'm pleased to see the funds that are going to states like Alabama, Mississippi, and others to strengthen broadband internet access, both for the education of our children and also hopefully to bolster the use of telehealth. We still have work to do, of course, to get consumers comfortable in using telehealth, but I do think we have some interesting potential there. The Association of Schools and Programs in Public Health tell me that there's been a tremendous increase in student enrollment and admissions in public health programs around the country. And I think that's a great thing, and I hope that UAB is experiencing that as well. We're going to need to in the field of public health. And I think we've seen, while we still see some issues with the use of solid science, as I mentioned earlier, we have seen discussions in the mainstream news media more and more about public health, virology, genomics, and infectious disease than we've seen in the past. So, Elena, I'm going to pause here for a second. Take a look at the Q&A. There's one that says, what would be the best way to recruit more people into public health? And I think Dr. Irwin has also posted in the chat probably the best answer to that question. I think projects between departments of public health and schools in public health, and when schools of public health have strong practice engagement like yours does, that those are good recruitments. Awesome that you've had a 65% increase in graduate student enrollment. It might not be awesome from the workload for the faculty perspective, but really cool. One of the things I also think we very much have to address that I'll show you in a little bit, an initiative that has included this aspect in the work. And that is we absolutely must have a candid and honest conversation at the national level that will hopefully then impact the state levels about the disconnect between the way most of our governmental merit systems, personnel boards, whatever they're called in the various states, there's a disconnect there. With the way that they classify and therefore compensate public health workers. And when governmental public health is unable to compete for epidemiologists, for public health nurses, for public health social workers, nutritionists, environmental health workers, on and on and on, when they're unable to compete because of those archaic merit systems, there has to be some candid conversations about bringing those systems into the 21st century. And I think any time that our students can have wonderful practice experience so that it opens up possibilities in your thinking. I know because I have a nursing background, when I was first exposed to public health, I had a lot of nursing colleagues that said, oh, you're going to work in public health to give shots. Well, certainly immunizations are a huge part of what public health does. And they're an overwhelming part right now because of the COVID vaccines. But certainly when I entered public health, that was not, I was a neonatal intensive care nurse and labor and delivery nurse, and I entered public health working on a project to decrease infant mortality in the state. And, you know, it was a long time before I ever actually gave a shot. So I think the more that we expose students and other colleagues to public health, those are all good initiatives. Elena, did I get the question or do we have others?
No, just like you were saying, another comment from Dr. McCormick, just increase opportunities for those applied practice experiences with state and local partners. And especially one other benefit from the COVID experience is just there's more virtual opportunities. So a student has the ability to work across state lines if they couldn't financially afford to move, or work with organizations that they may be interested in, but they're not able to be there in person. So another great benefit, another benefit or positive of the COVID experience.
Yeah, thank you, Elena. I totally agree with that, Dr. McCormick. I think, and for those of you who are students here, my advice here would be don't just settle into what you think you want to do because that's what you've been exposed to. If you've got the opportunity, spend your time really understanding the whole picture of public health practice, because I can assure you It's a rewarding field, and there's a lot to do in a lot of different interest areas. So I just want to mention a little bit about what makes public health a profession. That may seem like a really sort of strange topic, but I think because we often come to public health not every from various backgrounds, not everyone has a degree in public health or starts there. Maybe some of you who are students are like me. You started as a nurse or a physician or some other profession, and we sometimes have a little difficulty marketing public health as a profession. But there are, to me, three things that make a profession solid. And one is that it has competencies for how it educates its members. And of course, your school is accredited, and I'll speak about, well, I'm going to skip on through that, and then I'll come back to these. So the schools that are accredited, schools and programs in public health by CEF are schools that we know teach the best and adhere to the newest, best, and greatest in terms of the standards for what public health professionals should know. So graduating from an accredited school or program is one of the keys. And I think that one of the best things that has happened in the last few years is the addition of the baccalaureate degree in public health, because that provides an entry level into public health, especially in some areas where starting with a master's or a doctorate might be a little more difficult to do. And then after the graduation from the program, or even for practitioners, we do have a national certification in public health. And that was created about 12 years ago to professionalize the field of public health. And that certification ensures a common body of knowledge and a competent workforce with profession-wide standards. And these are the current domains of the Certification in Public Health exam. And you can see, if you're, and I know you are familiar with the 10 essential services of public health, the domains of the CPH exam mirror closely the curriculum competencies that all of you who are students and faculty work on. And they also mirror very closely the accreditation of the health departments, which I'll talk about in a minute. There's amazing alignment among the three. You can sit for the CPH exam if you're a graduate of a CEF accredited or applicant school. And I understand that there are 48 individuals from Alabama who have obtained the CPH certification, so kudos there. In the recent years, the National Board of Public Health Examiners has also added a workforce category to be able to sit for the exam. So for faculty and for practitioners who've worked for 3 years in public health and a graduate level degree like community health or a CEF accredited certificate program as opposed to a School of Public Health, or 5 years and a bachelor's degree can also sit for the exam. And so a lot of people ask all the time, what do I get out of out of being certified in public health. Well, that's what you get, is verification that you have the knowledge to be able to practice our profession. And then, of course, we have, as part of professionalizing our profession, is the accreditation of the health departments. And those accreditation standards and measures are being updated now and about to be released in a 2022 version, reflecting both the changes from last year in the 10 essential public health services on the left, and a new component is the foundational capabilities are also called out specifically in the accreditation of health departments. So when you have solid education in a profession, you have certification of the individuals to practice that profession, and you have accreditation of the sum of the workplaces in governmental public health, then we have quite a strong three-legged stool, if you will, to be able to practice our profession. So I want to talk a little bit about what APHA is doing. I would be remiss as president not to talk about this, but I'm not going to spend a whole lot of time. I will share these slides with Elena and Mina, and they can share them with you if you're interested. But the 2022 advocacy projects for the American Public Health Association speak to who's caring for the workforce, because the number one advocacy priority is to increase and protect the funding for vital public health agencies and programs, upholding the Affordable Care Act, addressing health impacts of climate change for those of you who may be interested in working in environmental health. That is a huge component of what APHA is doing. Upholding critical public health laws and regulations and reversing damaging rollbacks. APHA is a partner with the National Academy of Science, Engineering, and Medicine, actually in a new alliance that is monitoring legislation all across the country during the state legislative sessions, which appear to be aimed at reducing the impact that public health laws and regulations have on our safety. And that is also aimed at supporting those public health workers whose jobs it is to either promulgate regulations or to enforce those public health laws. Addressing the nation's gun violence epidemic, of course, has a great impact on our public health workforce, because not only are we seeing an increase in gun violence in society in general, but an increase in gun violence against public health workers. And then there's a whole body of advocacy work to advance racial and health equity, and that includes looking at the diversity and inclusivity associated with the public health workforce. I'm going to skip through the next several slides because they're the details of each of those, but I will share those, like I said, in case you want those details. I want to be sure and point out 2021, just a little over a month ago, the Bipartisan Policy Center published a report, Public Health Forward, Modernizing the U.S. Public Health System. And what that bipartisan policy report that I was privileged to be a part of, as well as a number of other public health practitioners, policymakers, legislators across the country, was to look beyond COVID. what did we learn? What could we do differently? And the report, while it's a national level report and much of it is aimed at what Congress or the federal government can do, those each have implications for then what state and local policymakers can do. And actually the report has a section on for state and local policymakers. But there are 5 major categories, and I think you'll see amazing consistency with APHA's advocacy platform. Here again, we're talking about advances in health equity, sufficient, predictable, and flexible public health funding that supports public health system. And there are already grants that have been made available to researchers who have expertise in the way that public health is funded, who are actually studying states who did well with the influx of federal funds in order to address the pandemic, and those who struggled because of the financial barriers. And so I think we'll have some best practices and some interesting lessons learned about how to move forward with flexible funding public health in the future. The third category is more robust, modern, interoperable, and secure information system. I think if COVID didn't teach us anything, it taught us that 2-year-old public health data isn't sufficient or adequate in order for public health workers, whatever they're doing, to be able to inform the public about public health threats and emergencies, and to, in a real-time sort of way, inform policymakers about policies that need to be updated. And then that does lead us again to the common theme about modernizing our laws, policies, and statutes. So for those of you who are learning a lot about how to make effective public health policy and how to monitor those, that's an emerging area that requires ongoing diligence. And then the highly skilled, trained, and diverse public health workforce. Here's where you find the recommendations about supporting you and me and Dr. Irwin, Dr. McCormick, and others as members of the public health workforce, and different approaches. This is where we get into the conversation about student experiences, about repayment of loans, student loans, and also about the work with the merit systems that I mentioned earlier. And then I'll mention one more thing, and then be thinking, because I want to ask you for your reflections on thinking about becoming a member of the workforce, what your biggest questions are. There has also been, over the last 2 years, a strategic effort funded by and housed at the Beaumont Foundation in Washington, D.C., but to pull together a national public health workforce consortium, not to duplicate the efforts of any of the organizations who are supporting public health workforce development, but to create a forum where these organizations can come together, share best practices, talk about where the gaps are, bring in new partners such as the directors of those state merit systems that I mentioned, as well as businesses and members of the health system who employ public health workers to carry out their mission of their commitment to improving the health of the community they serve. So watch for more. There is call to action on the website for the National Consortium for Public Health and Workforce Development, and there's a specific consent agenda around how this group can continue to coordinate and not compete, so that our national approaches and our state level approaches and our local approaches to supporting the public health workforce are coordinated and strategically planned. And then last, I will end by telling you that this year is American Public Health Association's 150th anniversary. APHA was founded and originally chartered 150 years ago in Boston, Massachusetts. So we will return there, COVID permitting, November 6th through the 9th to celebrate the American Public Health Association, and in many ways public health in general, past accomplishments as well as our future opportunities. So you can check out the APHA website if you're interested in knowing more about that. And before I wrap up so we can have a little bit of conversation, I just want to leave you with this quote. I love Vince Lombardi in many ways, but when he talks about being a member of a team, earlier I talked about member of the public health family. I welcome you as students who will graduate to the public health family, and to those who are faculty and staff who support our pipeline of public health workers and who contribute to the research and the science that is so desperately needed. Your individual commitment to the group work of public health, regardless of the setting that you choose, is what makes the public health team actually work, because it's what makes a company work, a society work, and ultimately a civilization to work. So that with that, I thank you. I will stop sharing. And Elena, I think we have a few minutes if we have questions. How do you think we can have the public be more confident in public health workers? Well, that is a great question, and particularly now that our public health workers are undergoing so many threats and, have become so disillusioned. And I think we have to look, first of all, to us as part of the workforce. We have work to do. It's our responsibility to continue to be out among the communities, to continue to partner with community leaders in order to get to know the people that we serve locally on a personal basis. And I think that when we as organized public health can do that, it's really much more difficult to display this lack of confidence and mean-spirited comments when you actually get to know people as people. And that's an underlying principle I know that you're learning in school there as you think about community organizing, community partnerships. But we first have to not be apologetic for supporting the profession that we love. We don't need to be apologetic, and we need to engage our partners in helping us also to carry the story. There will always be people who disagree with us philosophically, but I think that, again, as we get to know our communities and we really work with them, we are all part of a huge family who believes that collectively we can impact the health of our population. So does APHA have any available training resources or professional development opportunities for public health workforce members? Yes. The APHA website, if you go to the website, in particular if you log in as a member and then go to the professional development tab, there are tons of webinars that have been recorded about how to cope with COVID, with the stress of COVID, how to get messaging out that is science-based. There are also webinars there around the health and racial equity initiatives, tons of webinars. We've used a lot of those with our workforce here in Mississippi. So go to the APHA website, click on the professional development, and most of those, or a lot of those, do have CEs attached. I will also call out 2 other partner organizations who have dedicated a lot of time and effort to public health workforce professional development, and one is Public Health Foundation and their initiative called TRAIN, TRAIN, all caps. There are a number of new professional development activities there. And then the CDC Foundation has really stepped into the space during COVID of being aware of some of the messaging that the workforce needs around science, around regaining the public's confidence. And so if you go to the CDC Foundation website and look at the consortium there for public health workforce development, you will see a number of resources there. I can also send those links to Elena if with my slides, and I will do that so she can share those with you. You won't have to look them up.
And we had one more question is kind of tied to that, but what are some of the best ways for current students to get involved in APHA?
Oh, wow, that's a wonderful question. You may or may not know this, but APHA has a huge, wonderfully engaged student assembly. Actually, of the 25,000 APHA members, 7,000 of those are members of the student assembly. So if you go on the website, apha.org, and you go through the communities, there's a tab at the top that says APHA Communities. Click down on the student assembly and get involved with that group. They are rocking and rolling. And I'm going to tell you, there are some awesome emerging leaders in that group, and you as a student can become one of those as well.
Does anyone else have any final questions before we wrap up the webinar today? And thank you, Dr. Bender. That was a wonderful presentation. I really enjoyed, hearing more about your perspectives about the public health workforce and all the good that they're doing. We have one more. What are some good ways to promote the National Board of Public Health Certified in Public Health? So how can we help promote that?
Yeah, so nbphe.org has some of that messaging, but I will tell you that organization is also revamping a lot of their benefits of certification. I will send Elena when I send her these other information, I will send you the one-pager you can use to promote it. But stay tuned to that website, because over the next 2 or 3 months, you are going to see a good bit more marketing and testimonies. And I see what are the foundational capabilities. So I'll be real quick with that. If you go to phnci.org, I will send that website to Elena as well. Foundational capabilities are are those capabilities that should be present in a community everywhere in order for public health to work anywhere. So they're like the very minimum. Accreditation standards contain those, but they go a little bit further. But the foundational are really the core, the very core. And thank you to the person who offered to mentor folks to earn their CPH. I think you'd be glad you did that. But Elena, I will wrap up there. Thank you so much. I wish you all the best with your career, and I'm looking forward to seeing you in the future at public health events.
Thank you so much, Dr. Bender, and we'll include links to everything that we talked about today in our newsletter when we send out a link to this recording, and we'll also put it in the recording on our website. So thank you so much. We really appreciate it. And there's lots of thank yous and awesomes in the comments. So thank you so much, Dr. Bender.
Thank you, guys. Have a good rest of the week. Stay dry.
Hope everyone has a good day. Thank you for joining us.